I'm Dr. Barbara Ostfeld, a professor in the Department of Pediatrics at Rutgers Robert Wood Johnson Medical School and program director of the SIDS Center of New Jersey. If I had a magic wand to wave to make one change when it comes to infant-safe sleep, what change would I make? The one change would be in funding, but it has three parts. Better funding for research related to potentially treatable but as yet undetectable causes of a sudden infant death, better funding to assure equal access to safe sleep equipment, and better funding to address the adverse social and health determinants that elevate risk and contribute to disparities in rates. And examples can include poverty, preterm birth, and access to care.
Hi, my name is Sarah Drum. I am a bedside nurse in the NICU at Boston Children's Hospital, and I am also co-chair of our hospital's Infant Safe Sleep Subject Matter Expert Committee. So answering the question of what I would like to see if I could wave a magic wand related to infant safe sleep, I'd have to bring it back to my bedside practice in the NICU. And I noticed that when I am working with families who have their first baby, when I bring up infant safe sleep, in most cases, they have never heard of infant safe sleep in any of their prenatal appointments, any of the classes that they've taken. So my wish would be that infant safe sleep is a part of everyone's prenatal care and all of the education that they take. And I was thinking back to when I was a child growing up in the 70s and 80s. One thing I could relate this to is wearing seatbelts in cars. First of all, I'm pretty sure my parents' first car didn't even have a seatbelt in the back. And then wearing helmets on our bikes. That was another thing that we didn't used to do. Then it became law, and next thing you know, everyone wore a helmet when they rode their bike. So if infant safe sleep could be just like that, you don't think twice about putting on a seatbelt when you get in a car. You don't think twice about putting a helmet on when you get on a bike. And wouldn't it be great if new parents didn't think twice about only placing their infant in a safe sleep environment to sleep? So that's my wish. Thanks so much.
My name is Shayna Rayfield from the Claire Bear Foundation, and if I had a magic wand to wave, I would take unsafe products for infant sleep off the market.
So, well, if I had this super industrial sized magic stethoscope wand, I think what I would do is eliminate poverty, right? Because there are health disparities, and a lot of this comes out and health outcomes are based in these disparities. And if you don't have access to healthcare, if you aren't able to be take the time off from work so that you can spend time with your baby and do your breastfeeding and do all these things, you are going to be behind with that. And I think that's why we see higher rates of infant mortality overall, as well as SUD, compared to European countries, because they take care of families after birth. So I couldn't get rid of poverty. That's a pretty big ask. So I don't know if we can do that. But if there's something I think would be reasonable that we could do, I would go to the government, to our government, and say, you need to make a standard law of 6 months of paid time off with support, family support services to improve lactation, to have access to health care, to be able to get a good night's sleep as best you can, and not have to worry about all these other things, about going back to work and not being able to breastfeed, having to worry about where your next meal is coming from, or whether you're going to get kicked out of your apartment because you can't pay the rent and you've got to go back to work. So I would love to see us do that, just like other countries in Europe do. And I think that would have such a huge impact on overall health of our communities, and especially how well babies do in the first year of life.
Hello, my name is Lily Leonardi. I'm a retired law enforcement professional that served as both a police officer and with the FBI Pittsburgh Division. If I had a magic wand to wave to make one change when it comes to infant safe sleep, I would wish that every expectant mom and new mother be made aware of infant safe sleep, as well as all first responders as part of their field training.
The biggest challenge to me, what I think is the communication or the lack of communication. Unfortunately, healthcare now has become more of a business, so everything is rushed. Families go in, it may be a single parent, it may be two parents. They are tired, they are overwhelmed, and all of this education on how to raise your baby for the next 18 years is thrown at them in less than 24 hours. So I think that having the consistent messaging so that everywhere in the OB's office, to the delivery room, to the pediatrician's office, to all of the prenatal classes, having family support. I know that that's not always a possibility, but making sure that we're providing the education that's evidence-based, but not just saying, you follow the ABCs of safe sleep, alone back crib, explaining, taking the time to explain, and then doing it, developing relationships so that with your families, so that in fact they feel comfortable coming to you saying, you know what, I really could use some help. Because families are embarrassed to admit that they need help. And so they're resistant. So I think with that communication and relationship building and really treating them, families, as though you're part of their family, I really do think could help reduce our infant fatalities related to unsafe sleep.
Yeah, we've talked a lot today about what to do with the system that we're given that is inherently under-resourced. And I think that what we really want to do is everything we can to push our country in a direction where we actually realize that early education is the most important part of our education system. It's where our most vulnerable children are, and yet we don't fund it anywhere close to what we do for the rest of the education system, right? Like in K-12, we have resource officers and counselors and nurses at schools to make sure that kids are not only receiving education, but they're safe while they're there. Childcare programs don't have any resources like that near them. They have to rely on how much parents can pay out of pocket in order to do all their staffing and have all of these safe practices in place, and parents can't afford to cover all of those expenses. So until we get to a point where childcare providers are not making poverty wages, in Washington State here, childcare educators rank in the 3rd percentile of all occupational wages in our state. That's less than parking lot attendants and pet groomers. So we literally pay people more money to watch our pets and our cars than our babies right now. And that results in high turnover, which means you always have staff coming into programs that don't have that training and background and awareness of what these safe practices and quality care look like. They have to learn that on the job. And programs are continually dealing with that cycle of turnover. And so we need to approach childcare, we need to approach early education the way that we do the rest of our educational system, to make sure that every parent can afford to access childcare, and that every childcare program has the resources they need to pay their staff a living wage, which then enables them to require things like an education and qualifications and training and a background and everything that they need to know in order to not just provide quality care, but ensure that every child is looked after and is in a safe place while their parents are at work. This is absolutely something we can do. We fell one vote short in the Senate just a couple years ago of actually accomplishing a lot of these things. And so in addition to connecting with your CCR and our agency around how to navigate the system and get the questions that you need to access care, I would also talk to your CCR and our agency about how you can get involved in advocating for more resources to be put into childcare and be done so in a way that ensures we have qualified people looking after all of our kids, and every family can afford to take their child to a place where they know they're going to be nurtured and safe while they're at work.